So our first entity is deep angiomyxoma, aka aggressive angiomyxoma. So even from the name, we already know it should be the location should be deep. And then there is another is aggressive. So that means this patient maybe infiltrates into the tissue. And then we have angio, that means we have blood vessel, myxo, that is the myxoid stroma, and then forming a tumor. So the terminology already see it in the name, but I highlight here, this lesion should be hypocellular. And we usually find this lesion in vulva, vaginal, and pelvic area, and then usually in patient of reproductive age, and then had 30 to 40% risk of local destructive recurrence if incompleted excision. And from the growth sample, usually kind of big, more than 10 centimeter, poorly demarcated. So let's see this MRI. We can see this really deep mass, and then pushing the vagina. Then let's see the microscopic characteristic of this lesion. So as I mentioned, it should be hypocellular and then uniformly with infiltrative margin. And even the name say angiomyxoma, but for me it's more edematous. That means that this matrix is not that blue as other entity we will mention in today's lecture. Then another characteristic is this medial to large size vessel and often with hyalinized wall. And one feature is really kind of unique for this entity. That is the smooth muscle, often close to the vessel. The buzzword is myoid bundle, and then mitosis is rare. So here we can see this medial to large size vessel, and then they have this characteristic nice thick wall. Then this is the tumor cell. They are small spindle stellate cell without significant atypia, so look really bland looking. Then this is the kind of specific feature for this entity, even though in other entity we also can see this. But when you see this, you should think of this diagnosis. So this is the vessel, and then adjacent to the vessel, we can see this small muscle always forming like vesicular growth, like lineage looking like this. And the immunostaining is Desmin, ERPR, HMGA2 positive. And usually this lesion is S100 and CD34 negative. So let's see some a virtual slide for this entity, aggressive angiomyxoma. So we can see this lesion, even in the ink border here, still touch the margin. So kind of infiltrated grow and really deep. And this is the epidermis of the skin. So even in low power, we can see kind of a low cellularity, hypocellular. Then when we zoom in, we can see some vessel, tons of vessel here. And the vessel have this hyalinized wall that is characteristic. And then this in this hypocellular area, we're trying to find that myoid bundle. Somewhat like this, the smooth muscle just forming like this vesicular growth. This sample is not as good as the textbook, but we can still see this. Another area, we can also see this characteristic kind of bigger vessel with this hyalinized blood vessel wall and this smooth muscle bundle. So let's see another one. as I mentioned before, even in low power, we know this is hypocellular. And then really edematous, not really myxoid looking, not really blue. And then big vessel with this hyalinized wall. And then this one is metal. We can see this small muscle bundle. We call the myoid bundle. And then really deep, you can see in the margin, the ink margin, we can see this lesion not ended. Okay, let's continue. So the differential diagnosis I put here, we're going to talk about these three entities in today's lecture. And then for the desmoid fibromatosis, it's kind of easy to differentiate from this because this one, we have this spindle cell forming vesicular growth, and then we compare to this deep angiomyxoma, desmoid fibromatosis, kind of hypercellular. And then we have characteristic beta-catenin nuclear and cytoplasmic staining for this